I'll be honest. Wednesday's community meeting on the proposed methadone clinic on Wharncliffe Road left me completely dismayed. I knew the community response was going to be largely negative, and I stated as much when the whole bylaw proposal was happening and it included community meetings, that likely these would be very negative experiences. Yet, to hear people really depersonalize addicts and frame them as a danger to the community was still very depressing to hear, and just the lack of understanding of methadone and its role in actually decreasing needle use and property crime, which were things that were mentioned again and again by speakers, was that role of methadone was completely missed. And so I found myself at that meeting in the rare occurrence of being speechless. One of the things that I found that irked me was the consistent bashing of the applicant as a for-profit clinic, because it's worth noting that all methadone clinics are for-profit, and so are all dermatology clinics and endoscopy clinics and wound care clinics, and in fact, so are all family doctors' offices. Our healthcare system is a single payer system and it's a publicly funded system, but it's privately delivered. I'm open to debate that, and perhaps we should be publicly funded, publicly delivered, like in Sweden or somewhat more in France. But if we're going to eliminate non-profit clinics, then unfortunately we also wipe out your family doctor's office. So in this case, the for-profit argument is a moot point in thinking about this particular site and this particular service. But really, what was more troubling to me than hearing people say they wanted the site elsewhere was hearing people wanting to remove treatment altogether. One speaker said, rather sarcastically, with alcohol addiction, you don't see us giving them medicine, so why should we do that for drug addiction? Sadly, research has been trying for years and years to come up with just such a medication for alcoholism, but have been unsuccessful. I mean, could you imagine? Could you imagine we came up with a medication, you just take a small drink of it like methadone, and for the whole day you don't crave or you don't need alcohol? I have an individual in my extended family who is an alcoholic, and I don't know if you do or if you know someone, but imagine what you would pay for such a medication. Hundreds of dollars, thousands of dollars, everything you have. And now just imagine that it's included as part of our healthcare system and the person can get it for free. I mean, that's what methadone is, and that's what it does. It saves people from being consumed by their addiction and puts them in a position to reconnect with their work and with their family and their friends. I mean, this is something that we need because we need to do something about addiction, and methadone is an effective treatment. But let's get back to the site issue, and I agree with this particular site and with this particular applicant. Absolutely, we should discuss it. That's very important. But I think the meaningful discussion was lost amongst all of the vitriol that I heard. And, I mean, the company does have a negative track record. Now, none of it's related to delivery of their methadone maintenance treatment or the quality of patient care in that area, but still, they're no shining star. And the director, the lady that came to talk to the community that night, was just not a good promotion of the whole thing. Her preliminary presentation did little to educate people to the issue, and as she got more and more agitated with people's comments, she really just fanned the flames of the fire. City staff, on the other hand, particularly John Fleming, were amazing and were consummate professionals through the whole thing. I mean, in terms of the site itself, though, my biggest problem is I try to be evidence-based. I try to be reasoned in my thinking. And right now, I'm going on the knowledge that there's a rumor that with the 5 clinics we have in London, 4 are full and 1 is over capacity. However, that's just rumor. And someone needs to simply go to the site that's just up the street on Wharncliffe and ask them, do you have capacity? Are you taking new patients? And secondly, where is the demand coming from? They have people's health cards, so they know where people are coming from. And is the demand coming from this neighborhood? And if indeed they are closed to new patients and the demand is local to Old South, then yes, we do need another clinic. So what do we do? Well, I think asking the applicant to cite it further from a daycare and the ice cream shop, that's a reasonable thing to do. That's a nice way that the community could meet this applicant halfway and both ensure that we have the services that decrease crime in our neighborhood, but also are happy with that location. But if, however, the current clinic is still accepting new patients and there's still space for people to come from Old South, then asking them to relocate to an unserviced neighborhood is makes sense. But the silly thing is we just don't know, and so it's based on a lot of conjecture. So I think city staff really need to spend some time before the public participation meeting to look into that issue and look into the capacity and the need. Overall, though, I think Megan Walker captured my dismay for the evening when she spoke. She said, Old South is a community that she loves, and it's known for its diversity and its openness. We have young families, we have old families, we have gay parents and straight parents, rich and poor, white and minority. Yet, unfortunately, on Wednesday night, we drew a line in the sand as a community and stated, this we do not want. And I understand that that's only 300 people, 30 of whom actually, I think, shared a different perspective and who clapped when people actually supported the idea of treatment. But as was reported in the paper, this is perceived as the community's perspective. And so I think this perspective needs to change. I think we need to recognize people suffering from addiction as humans, as members of our community, ensure they have the treatment that actually prevents them from turning to crime and prevents things like needles being found and people being broken into. And have a discussion of where that should be, where that clinic should be. Absolutely. Work with the applicant to cite that in a place where it's needed and where the community is okay with. Thanks.